Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Nita Valens, you look gorgeous as usual.
Hi, Dr. Darrow.
Hello, can you hear me? Hello?
I'm not hearing you.
Well, that's a problem, isn't it? I can hear you.
Oh, okay, there you are. There you are. So how are you today?
I'm good. And you look gorgeous, I just said. You didn't hear it.
Oh, you're such a sweetheart. Thank you so much.
I try to be.
Well, you look adorable with your baseball cap on, and there you are on Facebook Live, and, you know, we're all good here. So what are we going to do for our listeners today?
Well, we're going to talk about my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, meaning we can use stem cells and platelets, cells from your body, and re-inject them into areas where you have musculoskeletal pain. That means your joints, your ligaments, your tendons, areas all over the body. I inject anywhere in the body where there is pain, where there's been an injury, arthritis, and it's a very simple procedure. You walk in the office, you get injected, and you walk out. So it's quite a bit different than doing surgery, which we do not like people to get unless it's an emergency or something they really have to take care of. By the way, we're going to give out a copy of my book today, which is Stem Cell and Platelet Therapy, Regenerate, Don't Operate, to anybody that calls us right now at the studio. We're live at 866-870-5752. I'm going to repeat it while you go grab your pen and pencil. Give us a call. We like the excitement of new callers. It's a lot of fun. Let me answer your questions about your musculoskeletal pain, especially if you're considering a surgery and you don't want to get one. So the number to talk to me live right now is 866-870-5752. If you want to call the office, there are people there too that can answer your calls there if we don't catch the information on the show that you're interested in. And the phone number to the office is 800-300-9300. That's 800-300-9300. And to watch videos of me doing these procedures, you can look at www.jointrehab.com. That's www.jointrehab.com. And that website has a spot on every single page to send me an email. So if you want to email me, you can get to me that way also. So I'm looking at the foreword to my book right now, and there's a picture of the lovely Suzanne Summers, who's an advocate of my work. And she has a book out. Nita, remember the name of it? Let's see.
I do. She actually wrote a book called, oh gosh, that's so funny. It just left my mind as I said that.
A New Way to Age.
A New Way to Age, yes.
Just looked over my shoulder and saw it sitting on my credenza here. And her books are amazing because they talk about natural and safe ways to heal the body instead of getting medication and surgery, which is what we're trying to avoid. So this particular book, which I'm going to send you out for free if you call up right now, has a couple hundred pages in it and about 250 scientific studies on how platelets and stem cells work, and literally how surgery doesn't work in a lot of cases. And I can aver to that because in my office, people come in almost every day with failed surgeries, meaning they had a surgery and it made them worse or didn't make them better. And we get a lot of callers on the show that talk about that too, how they've had a surgery years before. I note that Chris is waiting, and he called in about his 90-year-old father's knees. So why don't we go to him? So Chris, this is Dr. Marc Darrow, And why don't you tell us about your dad? What's up?
Hello, doctor. Yeah, thanks for taking my call. Yeah, my dad is extremely healthy. However, both of his knees, one being a lot worse than the other through arthritis, and he had an injury when he was about 14 years old, and he was in the hospital for about a year with pins in his legs and so forth. And he recovered. He walks fine. He's always had a little bit of a limp, and it would snap out once in a while. But as he got older, his knees are getting worse and worse, and he's really somebody that doesn't give up. So he's not in a wheelchair. He's on crutches, and he's got a cane. But we're considering what alternatives other than surgery may work for him.
Well, I'm glad you're thinking about that, especially, I'm not in favor of these surgeries anyway. When people come in the office, I say, don't come in if you want surgery, because I'm going to pretty much steer you away from it, except in extreme cases. Your dad may be an extreme case, but at 90 years old, I'm not sure he would want a surgery anyway. I would have to examine him and see if it's something that can help. It usually will help, and obviously we can't give him back brand new knees, and
Right.
He had a traumatic injury, probably fractured his bones, because you said there were pins in his legs, so it probably was from fractures, and they probably pinned them back together. So
Yeah, actually, he healed up pretty well.
Yeah.
That's an injury that he had when he was 14.
Right.
I think it's more bone on bone. He's got excruciating pain, and if we
Okay.
can minimize the pain, even 50%, would be life changing for him.
Sure.
And,
And I hear people say that all the time. They say, I know that you can't give me a brand new part of my body, but if you can just get rid of some of the pain, then I can live with it. And that's often what will happen in these extreme cases. Your dad sounds like an extreme case with traumatic arthritis. And often what happens is when we have an injury, even a little injury, your dad had a terrible injury, it sounds like, but even a little injury, sometimes the cartilage will start to wear out slowly over the years. And this has been 76 years ago that he had this injury. So he's got a lot of wear and tear there. I'd have to examine him. I'm thinking we can probably help by using stem cells and platelets, but I like to examine people before I can give them the go-ahead and give them a lot of hope. There is hope here, but I do like to examine people first. I don't really care about the images very much, which sometimes makes people angry at me. They bring in 10 pounds of MRIs and CTs and X-rays, and I say my exam is really what counts. What it looks like doesn't really count, because I have a lot of people that come in with images that look absolutely awful, and they're not that bad off. And then vice versa. Go ahead, Chris. I'm sorry.
Doctor, have you had a lot of success with people at his age
Yes.
in the past?
Yes.
Awesome.
I take care of a lot of people in their 90s. I've had a few people 100 years old, and we have a lot of success. I don't find that age is a deterrent to healing. You would think it would be. And sometimes I get youngsters who have problems healing and oldsters that have no problem. So I never can predict. I really just can't. People always say, they try to pin me up on the wall and say, how long will this take to heal? How many treatments? Blah, blah, blah. And I go, I really don't know. And they say, but you're the expert. You know more than I do. And I go, really don't. Because healing is something that is, I'll use the word mystical to it. It's something that you can't pin down. And some people heal very quickly from stem cells and platelets, and other people take a long time. And I never can predict which is going to be which. And
Wow.
I don't know if you know this, but I have injected both my knees, my shoulders, my elbows, my right wrist, and I've had other people do my neck and back. I've had lots of injuries in my life because I'm a sort of a fanatic athlete. And actually last night about 6:30 I was hiking on the beach in Santa Monica, and it was high tide, And all of a sudden, a wave came out of nowhere and knocked me over onto the rocks. And I'm pretty beat up today. I'm hoping this will resolve. I mean, I cut my hand pretty badly. I'm going to go get a tetanus shot. And my shoulder's all skimmed up and bruised, and my arm and whatnot. And I'm hoping that my shoulder...
I hope you recover, too. You know, you've got a great reputation. And the reason I just cut you off, too, is I definitely look forward to getting an opinion on my dad, and if you can make that dramatic change for him where he's 50% or more less pain, that'd be great. And in fact, I had a soccer injury, and I have a knee issue too. I had 2 surgeries on my knee.
Oh, wow.
Replaced my ACL,
okay.
and it's shredded again. It's really bad. I have to be careful. So perhaps we could do kind of a 2-for-1, not a 2-for-1, but both of us come in and
well,
see
yeah.
you and
you can both come in. I'll be glad to check you out. So let me tell you about ACLs so you don't get really upset about what's going on. Most people with ACL ruptures that come to me do not need surgery. All right?
Right.
I know it's the knee-jerk reaction of surgeons if there's an ACL rupture to replace it, with cadaver or maybe your patellar tendon or hamstring tendon. But those often re-rip again, and It wasn't necessary to begin with. It's very rare I find someone with an ACL rupture that needs a surgery. Very rare that knee is actually loose, okay?
Wow.
Because there's muscles and tendons that hold the knee together anyway. It's not just the ACL. But in our society, if you want to call it modern, I don't, because surgery being modern is hurting a lot of people. And most of the work I do, people do not end up getting surgery, even though they were told by an orthopedic surgeon or neurosurgeon that they did have to have surgery.
Yep.
So I'd like to look at it. We can look with an ultrasound, see if there's any fluid inside. Be very careful, whoever you use as a doctor, when it comes to musculoskeletal complaints, that they use an ultrasound to look inside the body to see what's going on. And make sure that they guide the needle under ultrasound guidance. Because especially with knees and hips and shoulders, that spot to put the solution is so teeny that unless you use an ultrasound, you're not going to find it. And a lot of the solutions they put in don't even go to the right spot.
Right.
So be very careful.
Well, we look forward to coming down to your office and.
All right. And once again, you can call right now. The number to the office is 800-300-9300. There's people there now. You can call to get more information or set up an appointment. And for those of you that want to talk to me, want to call in right now to the studio, the number here is 866-870-5752. And Chris, God bless you for calling in. You've helped us educate many people who are listening about, their dad's knees or their own knees or any other part of the body. The nice thing about using regenerative medicine, using stem cells and platelets, is I can use that anywhere in the body. It just doesn't matter because all we're really doing is regenerating new tissue. We're stimulating the body to produce more collagen, and collagen is the major constituent in cartilage. So I've seen muscle tears repair, I've seen tendon tears repair, meniscal tears, rotator cuff tears, labral tears, you name it. This stuff works all over the body. So it's a godsend for a lot of my patients, and it's been amazing for me. So I'm going to give out the phone number once more, and then we'll go to Diane. The number to the studio is 866-870-5752. Diane, Dr. Marc Darrow, your knees are bothering you also. What's going on?
Well, first of all, thank you for taking my call. I'm very impressed with your knowledge. I'm a 72-year-old retired RN with bad knees. The doctor recommends bilateral knee replacements, which I have avoided for many years. I had to take an early retirement because of it. But, I've seen all the infections. I've seen an amputation post-replacement. I have metal allergies. So I know all the horror stories. But I was interested in this, but I had a question about range of motion. So I've lost a lot of range of motion.
Okay.
Is that anything I can get back, or is that permanent?
I'd have to take a look at it and see. Very often we can increase range of motion by stimulating more tissue growth. And of course, you would have to be compliant with doing some stretching afterwards when things settle down. I'm definitely not a fan of knee replacements. I've seen the same things you have. And on a hip one time, we had to replace an entire femur because after a hip replacement, the old prosthesis wore out and there was very minimal bone left, because these replacements can be very, very detrimental to the health of the bone. And you've probably seen this where people come back for a second replacement and they can't even do it. So I'm not a fan. Sometimes, I mean, if you've got a crushed joint, then maybe think about it. But I get way too many people that come in with shoulder replacements, knee replacements, hip replacements, finger joint replacements, toe replacements that just fail miserably. And then there's not a lot that the person can do. I see the same thing you have, people getting infections. And it's unfortunate that today's medicine has to do with surgery. You know that as well as I do. The work that I do is very, it's conservative. It's very simple. You come in, get a shot of stem cells or platelets from your body. And I can't remember ever having an infection. And I've been doing this over 25 years. But the infection rate with surgeries that I see is pretty high. And failures is very, very high. Did you work in orthopedics as a nurse or surgical floor?
I didn't per se, but I did work with a doctor who did inject joints. And he did use ultrasound. And
good.
So I know that it not what you're doing, but just with the steroids and so forth, for a bad bursitis or something. But
sure.
I'm very interested, and I'll probably call for an appointment.
Okay. Well, I'm looking forward to seeing you, and we can do a quick exam, look with an ultrasound, see if there's fluid in there, see if there's meniscal tears, all that, and hopefully save you from knee replacements, because I'm not a big believer in those. And you don't sound like you don't sound like you would ever have to have that. And especially if you have metal allergies, my God, that's the worst. People often get these replacements and then they have to have them pulled out because they're allergic to whatever it is that's put in. Or they just suffer with it in there because there's nothing else they can do.
All right. Well, you sold me.
Well, God bless you, Diane, and I think there's good hope ahead for healing up your knees from what you've told me.
Well, thank you for your work, Dr. Darrow.
Thanks for your call, Diane.
All right. I'm going to give out the phone number, so write it down. We'd love more callers. And the phone number to the studio right now is 866-870-5752. That's 866-870-5752. If you call us up, we're going to send you a copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. That means regenerate the tissue, rejuvenate it, don't cut it out. Too many problems with the surgeries that I see. A foreword by the lovely Suzanne Summers, who's an advocate of my work, wrote a chapter in her new book about my work, and she's had it done. I take care of her family. They've done very well also. And looking forward to hearing from you. And also you can call the office at 800-300-9300. That's simple, 800-300-9300. Or you can go to my website and watch videos of me doing these procedures. And you can email me from every page. And that website is www.jointrehab.com. That's www.jointrehab.com. We have another caller coming in here, and I'm waiting for...
Okay, do you want to give the...
There we go.
Mark?
There we go.
Okay.
We got a guy named Mark.
We do. Mark with a K.
Mark with a K. I'm Mark with a C. You got a little toe problem. What's up with it? Tell me.
Hi, doctor. This is about my girlfriend. She's very active. She's 55, and she stubbed her toe very hard.
Okay. How long ago was that, Mark?
5 weeks. And
okay.
The toe is still blue, and
okay.
it's still swollen. And she thinks that it can just heal on itself. I'm wondering, is there some kind of cast that a toe should be put in, or what would you recommend?
Well, we usually use the buddy system. You tape it to the next toe.
Okay.
And there's protection you can put around it too. 5 weeks out and still black and blue, I would get an X-ray and see if it's fractured.
Okay, if it's fractured, would the buddy system be sufficient, or would some additional treatment be necessary?
I wouldn't know unless we see the X-ray.
You have to see the X-ray. Okay.
Yeah.
Okay.
Because I don't know how far that extends, how bad that is. I don't know if it's displaced. There's too many unknowns. But an X-ray is easy to do. It takes a minute. And
okay. And am I allowed to ask you? I mean, do you see patients yourself?
What do you mean?
No, I mean, could my girlfriend be a patient of yours?
Oh yeah. I'm not just a famous radio personality. I'm just kidding. No, I do these. I do stem cells and platelets all day, every day. That's my work. That's what I do.
And how can someone contact you, Doctor?
Just call the office at 800-300-9300.
800-300. And what area are you in geographically?
I'm across the freeway from UCLA, where I did my medical residency.
Oh, you're in Los Angeles. Okay.
Yeah, we're in West
Dr.
LA.
Darrow.
Yeah. Where are you, Mark?
I'm in West Adams, LA. My girlfriend's in Redondo Beach.
Okay, good. Well, you're close by. I often hear, sometimes people call up on the radio, it makes Nita and I laugh. They say, oh, I'm in Redondo Beach, it's too far. And we have people fly in from all over the world to get these treatments. So,
and do you can you say what kind of insurance you take now, or is that something I would find out when I call your office?
Yeah, call the office. It's a mucky thing to talk about on the radio, so I prefer that.
Okay, and can you just repeat your number one more time? You said it's 800
Absolutely. Let me do it. It's 800-300-9300.
Okay, thank you, sir.
And also go to the website, www.jointrehab.com, and you can watch me do the injections. They're very easy. I do toes, fingers all the time, shoulders, knees, hips, necks, backs, you name it. Meniscal tears, rotator cuff tears.
Thank you for your healing ministry. I appreciate it.
Thank you, Mark. It's very interesting you said that because I was ordained to heal.
I had no idea about that.
And it was to me, it was a very fluky thing. I was ordained in 1973, and the spiritual blessing that came with it was healing. And at the time, I had just graduated law school. And I'm like, what the heck? Healing? What's that got to do with anything? And the minister that ordained me said, just be patient and you'll find out. And then 15 years later, after practicing law and doing his work, he said, now it's time you have to go to medical school. And I did pre-med and med school at the age of 40, started med school at 41. Wow. So I'm 75 now. I've had a great career in both law and medicine. And I love what I do. I love both careers, but I think I love medicine a lot more because the healing aspect is miraculous to me. This stuff has worked on my body. And the first time I used it was my wrist. I'd injured my wrist playing golf. I hit the ground instead of the ball. And I was 50% better overnight with the first treatment. I then injected it myself a few times and healed it up. I haven't had wrist pain in, I don't know how many, 20-some years. And then I did my shoulder, and that healed 100% overnight after a failed surgery. That means I had a surgery to fix my shoulder and it made it worse. So I'm a fan of this work, and most of my patients are too.
And one last question, Dr. Darrow. So these stem cells that you inject, if it's appropriate, do they come from the patient's body?
We can take them from the bone marrow, very simply. It takes me, after I numb up the area, it takes about 15 seconds for me to get them, Call the office about that to get more detailed information because we have some other callers.
Well, thanks for your time, Dr. Darrow.
God bless you, Mark.
Thanks for your call, Mark.
God bless your girlfriend, and appreciate your call. We love our callers.
We do.
All right, so we're going to go to Nicole and Cherie just in a second, but I want to give out the phone number to get more callers. and the phone number to talk to me live. And if you do call, you're going to get a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's a couple hundred pages. It shows all kinds of syndromes that I inject, and it's got all the research on how regenerative medicine works, how stem cells work, how platelets work, and how you can grow back your tissue and rejuvenate that part of the body instead of cutting yourself with a knife, which I'm not a fan of. So let's go to Nicole. Your friend has sciatica. Let's get into that, Nicole. Tell me about your friend. What's going on?
Yes, this is a friend of mine that I see weekly, and she started having pains, probably going on 3 months now. She's been to a doctor, and I think they diagnosed it as sciatica, and she got some kind of treatments. And unfortunately, I don't know too much more in the way of details, but my question is, can you help her? Can I send her to you?
Well, you can send anybody to me. I don't know if I can help them until I examine them. But the sciatica typically is an impingement of nerves in the lower back, and it forms a plexus that goes down the leg. So here's the most important thing. 94% of those, according to studies that I've read, go away by themselves without doctors. All right, so that's important information. If she's got some weakness going on, then it could be a real issue. Stick with us. We're going to go to the break, and then I'll get right back to you, okay? And we'll talk about your friend with sciatica. This is Dr. Marc Darrow. To get a hold of us on the radio right now, 866-870-5752. And to call my office, 800-300-9300. Stick with us.
We'll be right back after this.